I got power, poison, pain, and joy inside my DNA. I got hustle, though, ambition, flow inside my DNA. I was born like this, it's born like this.
Hey YouTube, Nurse JT. I am back with another video. So this video is going to be travel nursing one-on-one, the essentials, okay? All of the great things that everyone's told you about all over YouTube, as well as what they didn't tell you. So I'm going to be looking at my phone here because I wrote them down and I don't want to miss anything, okay? So I'm going to start with all the great things, of course. It's something new. Sometimes you just need something new. You just need to get away. Whatever's going on in your life, at work, you need to start over. It's a brand new start, okay? New location, new job, new everything. The second one is that it's better pay. I doubled my income when I started travel nursing. I went to California, and that's where I've done all of my assignments. To be honest, that's the only other state I've worked in travel-wise. Is in California. I doubled my income, and that in itself is enough motivation to go out and start travel nursing, especially if you have the type of life that you can sustain being away for 13 weeks, okay? Another one is autonomy. I love the fact that in between assignments, you do 13-week assignments. In between assignments, you can choose to work or not to work. You can choose to go right back on an assignment, to extend, or take a break for a week, or two, 1 month, 2 months, wherever you decide. You have that right. You have that say-so. You don't have to put in a request to your manager and hope it gets approved. No, you are your manager. You choose whether you want to go on another assignment or not. Another one is expenses are all paid for. Everyone loves this one. Yes, they do pay for your housing, usually transportation if you ask for it. They give you a monthly stipend or weekly stipend. It's basically a monthly stipend that's given out to you every week in your paycheck because you get paid every week. They give you a monthly stipend on top of your housing. And that's always great because that's really where you make your money. Your stipend and your housing is where you make your money. Your base pay rate is not gonna sound that great. But if they're coming correct with your housing and your stipend, that's where you're going to see a change in your paycheck. Another one is going to be number 6. You're going to meet so many different types of people. In Florida, it's especially racist. In Florida, South Florida, where I'm from, we have a bunch of Caribbeans. We have blacks, whites, Hispanics, Jamaicans, Haitians, whatever is over there in the Caribbean, that's what we got, okay? Bahamians, everyone, okay? When I came out to California, it was so different. I hardly ever in California see Haitians and Jamaicans. You see Africans because Africa's like right there. You're gonna see a lot of people from Asia because Asia's right there. So many Europeans. It's amazing how demographics determine where people are in the world. And I never really realized that until I left Florida, how different every state is. And that was one of the best things because I got to learn so much about different races and about different ethnicities and cultures. And I love that part, me personally. And number 7, this is going to be the last one. When in Rome, do as the Romans. When you're at the hospital, they're going to teach you how to do things their way. And I learned so much about how different hospitals operate, how the managers operate, how the system itself operates. And it's so different depending on where you are. And it helped me personally become a very well-rounded nurse. I got to see so many different things. Another thing about demographics as well, when you're in Florida, there's only certain types. Yeah, you see cancer, stuff like that, that's global. But population-wise, a lot of the times determines what you'll see as well. So that's another one that I learned. So now, to the things they did not tell you. What they did not tell you about travel nursing, because everyone knows about all the great things. They pay for your housing, and it's so much more money than what you're making. Because I left Florida making, my base pay was $29 an hour. And I don't know the last time I seen a check that added up to $29 an hour, not for the work that I do. And I, Lord willing, pray to never go back to that check, okay? So the first one is, it gets lonely, okay? I am a solo travel nurse. I do not have a travel buddy, which if you do have someone to be a travel buddy with, I do recommend it. But I decided to do travel nursing on my own. And my very first assignment was in Richmond, California, and which is not far from Oakland, because I had friends that were doing travel nursing in Oakland as well, which Oakland is like 20 minutes from Richmond. And I didn't see them often, of course, because nursing schedules, 9 times out of 10, our schedules never really link up with other nurses anyways, because we don't have set schedules. But I didn't realize how much I was not used to being by myself. I am an only child, but I have not been living by myself in years, since I was in college. Yes, I still live with my parents. I have lived with them all my life, and I had no problem with it, and I had no reason to move, nor did I want to move. But it just made me realize how used to being with my parents I was. And I became so clingy, not only to my parents, but also in my relationships, because I was lonely. I didn't like it at all when I first got there. It literally took me until about my second assignment to really like get used to being by myself and being okay with it. Because I'm an introvert. I'm an only child, so of course I'm an introvert. So I'm used to being like in my room or in my space, but I'm not used to being home by myself. Because my mother is a guidance counselor, so she works, she leaves the house at 7 and she comes home at 3, 4 in the afternoon. I usually don't wake up till around 11, 12 in the afternoon, so I only have a few hours being home by myself. But there it was, I'm by myself all the time. So it took a lot of adjusting. And eventually I got used to it. And it made me stronger, because I was so clingy. I was so used to people being there that I had no idea how to be just myself. And it made me such a stronger woman. And I'm so grateful that I did decide to do travel nursing by myself, just because of that in itself. The second one is housing and transportation. Now, yes, they pay for housing and transportation, but understand that it is a reimbursement, okay? So when you reach out to this agency and they find you a place and you're like, that's where I want to go, and they send you over the contracts, everything's written in stone, and you have your date, they're not going to send you a check prior to you starting for you to buy your flights, for you to get there. No. Everything that you pay for, how you get there, is coming out of your pockets, okay? So that flight that costs $600, that's coming out of your pocket. That Airbnb that you're going to be renting, that's coming out of your pocket, okay? And understand this, reimbursements usually are not reimbursed until your second pay period. So 9 times out of 10, and most people go a little earlier than their assignment starts. So you might have 2, maybe even 3 weeks before you get reimbursed for all of the money that you spent to get there. That's something that I did not know, and I wish that I had known. I mean, it is reimbursed to you, but you miss it when it's gone. And that's something that I didn't know until I started traveling, after my first assignment. I was like, oh no, I was not prepared, okay? But after that, I was prepared, and I knew what to expect, that I would have to wait for this money to come back to me. And so yeah. Another one is Another one with moving. It's a lot of moving, okay? A lot of packing and unpacking. Understand that you should not bring your entire closet. You will not wear 80% of the things that you bring. My first assignment, when I tell you, I literally had, and I have the big suitcases. I had one suitcase full of shoes. I had another huge suitcase full of shirts and pants. And then I had a carry-on of makeup. I had so many bags, it was ridiculous. Just hanging in the closet, clothes that I did not wear my entire 13 weeks. You think of 13 weeks as a long time, but when you're on that assignment, it flies, okay? It literally flies. You're not gonna go out every day. You're a nurse, you're gonna be tired. You work 3 days. The 4th day, you're gonna wanna be home at least one of the days resting, and then you have 2 other days where you can potentially go out and explore. So there's really only 2 outfits a week that you may need, maybe even 3 or 4, depending on if you go out that night after. But you don't need all those clothes, trust me. I didn't wear, like I said, 80% of the things that I brought on my first assignment. Another one is you're not gonna get much orientation. So you make sure you're a strong nurse before you decide to do travel nursing. I have seen them. My second assignment, I seen them. I came in with was it my second assignment or was it my third? I think it was my third assignment. I came in with a young lady. We both started together. She did not make it out of the orientation process. They canceled her contract, the hospital. They canceled her contract. I had a feeling they would because even I was like, you know, when you give some coworkers a side eye, like, girl. So I guess they got that vibe. They canceled that girl's contract, honey, and she had to go back home. Okay, and you basically lose all of that money that you spent because they're not gonna reimburse you because you weren't ready, you weren't prepared, you weren't competent. So make sure you're a strong nurse, okay? Because I think my orientation, most of my assignments was about maybe a shift and a half. Yeah, I would say about a shift and a half. And to me, that was okay because you really, they're not teaching you how to be a nurse. You should know how to be a nurse. You should know, if you're in the ER, you should know how to be an ER nurse. ER nursing and ER nursing, no matter where you are, the only difference is you need to know how they do things, where things are. That's what you need to know, okay? Overtime. Overtime. Honey, let me get you, I need to shift in my seat for this one. I don't know about you guys. There's some nurses, they do their 3 shifts and they're like, shoot, even 3 12s is too much for me. I'm not that nurse. Since about my very first year of nursing, I like to work at least 4 days a week. I like getting overtime because you see a big difference in your check. Those hospitals are not going to give you overtime. They are going to make sure they don't go over those 40 hours a week, okay? So if you do pick up an extra shift, 9 times out of 10, they won't give you anything more than an extra 8 hours. Because in California, you can work 8 hours or you can work 12s. So understand that, okay? So when you do your overtime, all that you're going to get is your base pay. Your base pay. So whenever you look at your contract, whatever your base pay is, that's the money that you're going to get hourly from that, okay? So all of that stipend, where the bulk of your money comes from, your stipend and your housing, that's not going to multiply just because you did an extra shift, honey. No, not at all. So to be honest, overtime at the facility that you are contracted to is not worth it at all. It's usually about $200, no lie. And I don't know about y'all, but I didn't sign up for $200-300 on an overtime. I did not come here an extra day for $200-300. No, not at all, okay? So keep that in mind because most nurses that want to work more than 3 days, what they do is they get agency, a per diem and agency outside of their contract for an extra shift a week. That way you feel your money a little better than if you were to do it with whoever you were contracted with. Okay. Your schedule is gonna suck. Okay. Every assignment I've ever been on, I don't think I have ever had more than 3 days off at a time, which we're nurses. It's easy for us to get 3 days off, but you have to understand that you're there to fill a need. Okay. So you are not gonna get the best schedule in the world. They're gonna just really put you in wherever. Okay. And you just gotta hope that it's not every other day if you're night shift. Most of the time they don't do that if you're night shift. You can't ask for block scheduling in your contract. What else? You can't ask for every other weekend. 9 times out of 10, they won't abide by the every other weekend because, once again, you're there to fill a need. Usually needs are on the weekend, so you tend to work every weekend. Another one is agencies usually ask you, is there any time you want to request? When they ask you that, put in something, okay? Even if you don't have plans, you're gonna want to go home, okay? 13 weeks, it flies, but that's a long time to still not see your family or not see your spouse, your significant other. That's a pretty long stretch, okay? So even if you don't have plans, put in for 5-6 days off just somewhere, at least once or twice, so that you can have time to yourself to decompress from the nursing world and to go on a trip somewhere. Okay, you're making all this money. Don't stress yourself. Don't work all the time, because they will work you almost every day. I'm telling you. Okay, if you let them. The last one is calling out of work. The thing with basically pay for the last one. So with travel nursing, if you don't work, you do not get paid. So if you call out of work, not only are you losing the hours that you put in, not only are your hours going to be short, but your stipend is going to be short as well. Okay? So you're losing money 2 ways. The first check that you get after you call out, that's when your money from your hours from the facility is going to be taken out. You won't, of course, have as many hours, so your check is going to be short. The week after that is when your stipend is going to be taken out. So you're going to have 2 weeks of checks that are short. 2, okay? So it's not really worth it. It's not worth it to call out. I did call out my very first assignment. Besides the fact that when on my first assignment, besides the fact that I was like not feeling it, I was stressed out, I was sick, I was like almost depressed and lonely. I was, like I said, I was sick. I kept getting sick. And I had to call out twice actually. I got sick like when I first got there, and then I called out for Christmas. First off, I worked through the holidays. I think I worked New Year's Eve and New Year's Day. And then they tried to have me work Christmas Day. And I was like, listen, I called out of work because I am not here to work all of these holidays, okay? I'm not here for this. So the flights to go home at that time were like $1,000. And I don't know about y'all, but I love my family, but I don't love them that much. Not to where I would spend $1,000 to go home to Florida. So me and my friends, we did a road trip and we went up to Lake Tahoe and we had fun. So, but I paid for it my next paycheck, because my next 2 paychecks, because since my check was short 12 hours, I felt it in my paycheck. And then because I didn't work and I called out that day, my agency took away some of my stipend. So I had 2 short checks. To me, it was worth it because it was Christmas. And I worked the other holidays and I didn't want to work Christmas. So to me, it was worth it. But understand that if you don't work, you do not get paid, okay? There is no PL bank for us. And that's pretty much it. So I hope that was helpful for you guys, because like I said, those are things that I had to learn once I started travel nursing. And like I said, I just hope that it was beneficial. So stay tuned for my next video. It's coming up. I can't wait to get it to you guys. I don't even know what I'm going to do it on yet. But if there's anything that you guys want me to touch on, like I said, send me an email, write me on Instagram, and don't forget to subscribe to my channel, okay? I am still going to do that giveaway to 10 randoms out of my very first 100 subscribers. And I'm still going to do a video about what I'm going to be giving away. So I can't wait to see you guys again. Stay tuned, all right? Bye.